Dental anxieties and dental phobias are very prevalent and are much more common than people affected by them usually realize. Here at the Modern Dentist, we see a huge number of patients who are affected by anxiety related to dentists or dental treatment. Thankfully, with the methods that we use for helping these people, the vast majority go on to become regular attenders who no longer break into a sweat at the very thought of visiting the dentist. Dental anxiety covers everything from just a mild apprehension about something specific, like the sound of a drill or injections, to full-blown terror at the very idea of visiting the dentist. Sadly, people in the latter category often stay away from the dentist for years until they're in agony or in dire need of professional help. If the thought of going to the dentist makes you feel in any way apprehensive or fearful, it's likely that you're affected by some form of dental anxiety. This may be related to past experiences or stories that you've heard, but often there's no identifiable cause. The most important factor in the success of overcoming your dental anxiety is your relationship with your dentist. This should always get off to a good start, and you should trust your first instincts when you meet your dentist. But it also takes time for that relationship to grow and develop. This is one of the reasons that the most successful technique that we use for people with anxiety is desensitization. Desensitization is by far the most effective technique that we use for people with anxiety. It means taking your treatment at a pace that allows your anxiety to slowly dissipate. So instead of starting with the most important or urgent treatments from our perspective as dentists, we instead will start with the simple, easy things like hygiene or preventative treatments, and we'll slowly work up to the bigger stuff as your confidence grows and you feel more and more ready to tackle those things. We have several methods of distraction during dental treatment so that you can focus on something else instead of what's going on in your mind. We've found the most successful method for us is the Sensate system, where a device vibrates on your chest in time with a soundscape playing through headphones, which tones your vagus nerve and regulates the nervous system. Complex procedures are for very nervous patients who really can't tolerate treatment while fully conscious, even with desensitization and distraction. We have a fantastic team of anaesthetists at Sedation Solutions who come to the practice and give intravenous sedation. This allows even the most anxious and phobic patients to have even complex treatments done without the need for general anaesthetic or referral to hospital. It also tends to cause amnesia afterwards, which minimizes any kind of trauma associated with the procedure. The most common causes of dental anxiety are previous bad experiences, pain, fear of needles, sound of drilling, lack of control, and gag reflexes. Call and speak to the team when you book your appointment instead of booking online. You can explain your anxieties to a member of the team and ask any questions so that you feel satisfied about what's going to happen on your first visit. If possible, come and visit the practice and meet the team and the people who are going to be looking after you. Fear of the unknown tends to be the biggest driver of people staying away from the dentist, and so these steps to help familiarize yourself with the surroundings and the people who are going to be looking after you tend to really help. It's really common to develop dental anxiety as an adult where you haven't previously had any issues with going to the dentist. There's often no identifiable cause for this, but the good news is that it can usually be managed fairly easily. In general, we prefer to avoid things like Valium and oral sedation because we preferred if we can manage people's anxieties with other techniques like desensitization and distraction. But for some people and for specific treatments where patients feel like they can't sit through a treatment without something to take the edge off their anxiety, we find that Valium can work really well. Dental anxiety can affect everyone from young children to adults, and even older people often find that they develop dental anxiety for no identifiable cause where they've been previously fine. But the good news is that most of these patients, no matter what age they develop anxiety at, can usually be managed and converted to comfortable, regular attendance. If you're terrified of needles, remember that on your first visit, we definitely will not be using any. So use this first visit to speak to your dentist about your fear of needles. We'll be able to find the right solution for you through a combination of our painless anesthetic techniques and the right anxiety management technique, whether that's desensitization and distraction or possibly sedation. Nervous dental patients and dental anxiety are essentially the same condition and are managed in the same way with the same techniques. If you have a partner who suffers from dental anxiety, one of the best things that you can do to help them is to bring them along to your visit to see the dentist or hygienist, preferably for something simple like a checkup or a hygiene visit. Often it's the fear of the unknown that keeps people with dental anxiety away from visiting the dentist. So a visit where they're not actually having an appointment, but where they can just familiarize themselves with the surroundings and the people who are going to be looking after them can really help. For most patients who are extremely nervous and feel that they really can't tolerate treatment while conscious, we find that conscious sedation with our anaesthetists works incredibly well, even in the most extreme cases. These days, we generally don't refer patients for general anaesthetic anymore because thanks to the advances in conscious sedation, it's no longer necessary. There are many causes for dental anxiety, including fear of pain, previous bad experiences, fear of needles, fear of the sound of drilling, and many others. At the Modern Dentist, we use various techniques to make sure you have a pain-free and stress-free experience. Dental anxiety does tend to become worse over time if it's not managed or dealt with. But the good news is that even people with pretty extreme phobias and anxiety can usually be managed with a combination of techniques that we use. The main impact of dental anxiety on oral health is that people tend to stay away. And because of this, small problems tend to become bigger problems, and often these patients only attend when they have an emergency and when they're in pain. And at this point, often slow desensitization is no longer an option, and we have to do sometimes unpleasant emergency treatment, which then doesn't help with the trauma and the anxiety. It's sadly very common that parents can pass their dental anxiety on to their children. They unintentionally use really unhelpful phrases, like telling kids that they need to be brave, and also through their use of words and their body language, they'll tend to pass on those fears and anxieties and let the kids know that there's something to be scared of. The best technique for reducing sensory triggers, such as the sound of the drill, is distraction. At the Modern Dentist, we use the Sensate system, which regulates the nervous system, slows breathing and heart rate, and allows people to feel more relaxed and not be so focused on what's happening in their mouths.